Welcome to today's press briefing on COVID-19. We have with us Undersecretary for Health, Dr. Libby Lee, from the Center for Health Protection, Principal Medical and Health Officer, Dr. Albert Au, and from the Hospital Authority, Chief Manager, Dr. Larry Lee, and from the Hospital Authority, Associate Consultant, Dr. Silka Ka. Undersecretary, good afternoon, everyone. Welcome to today's press briefing. Like last week, we will first hear from Dr. Au of the Center for Health Protection, and then we will hear from Dr. Lee about the situation in Hospital Authority. Afterwards, I'm sure that you will get the idea that the epidemic situation is worsening. The government is working on enhancing our protective barrier. We have target groups, that is the old and the young. A few days ago, that is the 25th of November, we have sent out outreach vaccination teams to residential care homes to vaccinate elderly people. As at the 29th of November, we have already administered vaccination to 1,000 residents in homes. In terms of children, we have Dr. Silka Ka of the Pediatrics and Adolescents Medicine to give you information about the pros and cons of vaccination for young children and adolescents and further information. I will now give the floor to Dr. Au.
Thank you, Dr. Lee. Friends from media, good afternoon. I will brief you on the latest situation of the epidemic over the last week. As you can see, this graph shows the daily number of infections. Last week, between 25th of November and the 1st of December, on a daily basis, on average, there were 8,582 cases, 8.4% up from last week. As you can see from the daily number of cases, the figure today was 10,137. From mid-November, we have been seeing a stable increasing trend. Last week, amid the increase, the major reason was the daily number of infections going up. The daily number of cases was 8,006 cases. Compared with the average daily number of cases, it recorded an increase of 8.4%. When it comes to imported cases, the trend is rather stable. Last week, on a daily basis, on average, there were 576 cases, which showed a slight decrease from the previous week. This table shows that over the last few weeks, the weekly number of cases, as well as on which day they became positive, as well as the percentage of inbound travelers testing positive between 25th of November and the 1st of December, showing complete data. As we can see, around 4% of the 97,154 inbound travelers tested positive. This shows a stable trend. Among these imported cases which tested positive, some 55% were found to be positive at the airport, whereas the remaining portion were found to be positive between days 1 and 7. When it comes to death cases, over the last 7 days, there is a marked increase. Over the last 7 days, we recorded a total of 115 fatal cases compared with the previous days. It showed an increase of 47.4% in terms of residential care homes. We can see that it is hovering at a high level. Over the last week, a total of 74 RCHE reported 114 residents and 12 staff members testing positive. Compared with the previous week, the level is at a high level, which is similar in terms of RCHD. 36 residential care homes for people with disabilities reported positive cases, involving 5 staff member cases. This graph shows the number of cases in residential care homes From mid-November, we can see a stable increase, and we are right now at a rather high level, remarkably higher than the previous peak in late August and early September. When it comes to schools, much like the community cases, over the last 7 days, we recorded a total of 5,775 cases involving students, representing an increase of 11%, whereas for staff members, there were a total of 1,130 cases, representing an increase of 9%. This means that school cases have the same trend as the community cases, recording an increase of some 10%. In terms of subvariants, this graph, well, actually, this table shows the new sublineages as well as the infected cases. In terms of imported cases, XBB is a majority variant. We find that some 100 BQ.1.1 and XBB new subvariant cases in terms of percentages. This graph shows right now among the locally acquired cases. As for random checks, we can find different subvariants, and these are their respective percentages. As for the new subvariants, for BQ.1.1, they account for 1.96%, whereas for XBB, it accounts for 2.11%. The remaining cases are either BA.4 or BA.5, with BA.5 being the majority, accounting for 72.23%. The remaining is BA.2 descendant lineages, accounting for 23.25%. In terms of sewage surveillance, it shows the daily situation, that is to say, the viral load per capita, as to the RNA copies per liter. Starting from mid-November, there is a rapid increase, especially over the last 1-2 days. The latest viral load per capita exceeded 1.2 million, approaching 1.3 million. These figures far outweighed the peak figures in early September, which is similar to the figures recorded in mid-March to late March, which shows that in a community, there are a lot of cases. Let us take a look at the global situation. This graph shows that the laboratory of the WHO, the figures in relation to coronavirus as well as seasonal influenza. The pink line denotes coronavirus. We can see that after the peak in July, it saw a decrease to a low level. However, for the recent few weeks, the proportion of positive samples recorded a stable increase as marked by the pink line. What is also of concern to us is that apart from coronavirus, seasonal influenza globally shows a marked increase in the positive cases, and it has reached a level which is even higher than the level we saw 2 years ago, which means that seasonal influenza is more active in the northern hemisphere. Let us take a look at the subvariants of the coronavirus. Between 7th and the 13th of November, BA.5 remains the predominant strain, accounting for 73%, whereas BA.2 and BA.4 follow BA.5. BQ.1 at 27.3% is a new variant found, whereas XBB represents 3.8%. We talked about seasonal influenza, and this graph shows the virus monitoring by the WHO. The number of weekly cases of influenza. Starting from October, there was a rather rapid increase. It surged to a high level, which is even higher than the record in the middle of this year. In the northern hemisphere, they have already approached the winter seasonal influenza. This graph shows the U.S. outpatient influenza-like illness figures. As we can see, this year, in around week 40, there was an increase shooting up to a higher level compared with the six seasons before. There is a peak of seasonal influenza. Likewise, in Canada, in week 43, it rose to surpass the baseline level, which means that they have already entered the winter seasonal influenza period, which means that they have actually entered the season earlier. By and large, locally acquired cases continue to increase and remain at a high level. Compared with last week, it showed an increase of 8.4% in terms of residential care homes. They remain at a high level. As for death cases, there is a marked increase. Compared with imported cases, they are more stable. Right now, inbound travelers testing positive account for some 4%. Globally, new subvariants keep cropping up, especially BQ.1.1 as well as XBB. For locally acquired cases, we continue to identify new subvariants cropping up. Finally, in the Northern Hemisphere, there is an active season of seasonal influenza, especially in the Northern America region. Thank you, Dr. Rao. I now defer to Dr. Larry Lee from the Hospital Authority. Thank you, Dr. Rao and Dr. Lee. Good afternoon. Over the last week, the number of inpatients is on the increase. This week, over 2,600 people were hospitalized. Newly admitted cases averaged 340 on a daily basis. From RCHE, the proportion is actually on the rise. Right now, 18.6% of the inpatients come from RCHE, compared with 11%, that is to say earlier last month. It shows a marked increase. These elderly people have chronic illnesses as well as low immunity level. Among the inpatients, critical and serious patients have increased to around 120 patients. Those requiring ventilator support or oxygen therapy remained below 1% and some 10% respectively. According to A&E medical officers' diagnosis as well as statistics, over the last week, people hospitalized and admitted through the A&E, 63% of them are related to COVID-19. For the remaining admitted patients, they were hospitalized because of different medical needs. Over the last week, 73% of the deceased patients more probable died because of COVID, whereas for the remaining 20-odd%, they passed away because of other reasons. The temperature dropped today, and we have to stay vigilant as regards our physical conditions. For senior citizens, in case of discomfort, however mild it is, please do a test to see whether you have infected, because the symptoms of coronavirus and seasonal influenza are very similar. Please seek medical attention. Take medications to reduce a viral load according to the schedule to finish the whole medication regime. Caretakers as well as confirmed patients can seek medical attention through different channels and receive different oral medications. Please take a look at the graph. First of all, for seeking medical attention in the flesh, you can make appointments using the phone. High-risk patients can use a hotline to make a booking. Secondly, HAGO, the teleconsultation and designated clinic function is up and running right now. For medical support hotline 1-836-115, we will also answer medical questions in relation to their situation. If need be, we will refer medical officers to provide teleconsultation services. The Hospital Authority has a dedicated team collaborating with the private team in order to be in touch with high-risk patients to provide information and support. If need be, we will refer patients to go to designated clinics to seek medical attention or use teleconsultation. Lastly, for registered private hospitals and doctors, they can also provide services. We hope that we can provide information to citizens through different channels in case of infection. However mild the symptoms are, please seek medical attention. We have already increased the service capacity of teleconsultation and designated clinics to make sure that patients can seek medical attention as soon as practicable. We can see that on a daily basis, some 2,500 patients are seeking medical attention through the aforesaid means. Doctors will also prescribe oral medications. According to statistics, HA has already prescribed 162,000 patients two types of medicine. Over 75% are aged above 60 years old. I have to remind you, please take the medications when you have received them, and please finish the whole regime according to the schedule. It is proven that patients can have the likelihood of deterioration reduced as well as have a faster recovery progress compared with those who do not finish the whole regime. We have already entered seasonal influenza period. We will be probably under both threat of coronavirus as well as seasonal influenza. Overseas research shows that patients will have a higher risk of serious cases as well as death if they have come down with both diseases, especially for senior citizens. Please take medications as soon as possible, as complications which are serious will ensue. Death may also be resulted. If children have not been vaccinated, please get them vaccinated as soon as possible. Please get them vaccinated with the seasonal influenza doses as well. They can actually take both doses at the same time to improve protection.
I now give the floor to Dr. Siu. Good afternoon. My name is Siu. From the beginning of the epidemic this year, about 160,000 children under the age of 11 have contracted the illness. About 16 of them died. And there are about 10 children who are staying at public hospital. There is one young boy, 5 years old, who's staying in Prince of Wales Hospital. He was tested positive on the 28th of November. He was sent to Netherthal Hospital A&E department. Later, he was transported to Prince of Wales Hospital. He is in ICU. He suffers from a serious condition. The boy has received one dose of vaccination. Earlier on, a 12-year-old boy who is chronically ill tested positive on the 27th of November. He had a fever and his condition was serious. He stayed in ICU this morning. His condition became stable. And this morning we received a report of a 22-month boy who's had a fever for about 3 months. He suffered from cardiac arrest and he was sent to Queen Elizabeth Hospital. We have to carry out further investigation. Children are not as vigilant when it comes to taking care of themselves and abiding by anti-epidemic measures. So vaccination is the most effective way to protect them. But the vaccination rate for this group is still low. Those between the age of 3 and 11, about 70% of them have received 2 doses. Only lower than 30% of them have received 3 doses. And only 10% of them have received 2 doses. And about 20% of them has received only 1 dose. Children are weaker in constitution. If they contract the illness, they will suffer from acute encephalitis as well as croup. Their condition may deteriorate rapidly. The illness may damage their brain. Upon recovery, they may suffer from medium and long-term complications. If you are vaccinated, it will reduce the chance of serious case and fatality, and also reduce the risk of long-term complications. So for the sake of your children, please make arrangements for your children to get vaccinated so that they will be better protected. Apart from COVID vaccination, you must be aware that the weather has changed and we have entered the influenza season. Yesterday, there was a child going to Queen Elizabeth Hospital suffering from influenza. The boy is a 3-year-old suffering from abdominal pain and fever. He suffered from influenza A. The situation deteriorated and he's relying on a respirator. He was sent to the children hospital ICU. His condition is critical. Children may be subject to the attacks of COVID as well as influenza. Parents should get them vaccinated as well. Thank you, Dr. Siu. I'm sure that you have all heard. The news is disheartening. I'd like to make the appeal again. We have entered the influenza season. The weather is fickle. Tell your children to keep warm, and if they suffer from any illness, please take them to see a doctor. Get medication if necessary. As you've heard from Dr. Siu, you would like to better protect your children, so get them vaccinated, whether it is for COVID or for influenza. You need to give them multiple protection so that they can stay safe and healthy in the epidemic and in the influenza season. I'll now open the floor for questions. Before you ask your questions, please identify your media outlet and ask only 2 questions. The report in orange. And from Now TV, just now, it's said that the number of cases has risen above 10,000, and then there is the influenza season. Would adjust the anti-epidemic measures because for death toll is increased at about 40%. So do you think we will be able to cope with influenza as well as COVID? Just now, in terms of children, about 30% of them have received 3 doses. In the future, would you tighten requirements under any of the measures? For example, vaccine passes to get them vaccinated. For the influenza situation, I'll defer to Dr. Lee as to whether there will be any tightening of measures. The government has been using science and a precision approach to make adjustments to all these anti-epidemic measures. We use this approach because we'd like to stay on top of any changes of the situation. At the moment, we still have room to monitor the situation for a bit longer. In terms of social distancing measures, at this moment, there will not be any relaxation, but we have not reached a stage when we have to tighten them. We'll closely monitor the information. Regarding whether there will be any tightening of requirements under vaccine pass, well, the new requirements comes into place on the 30th of November. Let me say once again that we need to protect the old and the young. Whether there is vaccine pass or not, we ask you all to protect the old and the young. Please show that you care about elderly family members and young children. If they are unwell, please seek medical attention, and if they are unvaccinated, please take them to get vaccinated. I'll now defer to Dr. Lee. The hospital authority is still at stage 2 of our contingency plan. We have mobilized about 2,000 hospital beds, and for the North Lantau Hong Kong Infection Control Center, 10 wards are operating. There are about 700 beds, and in the Asia World Expo is also used as a community treatment center. I would like to thank our medical teams. They have been working very hard. We continue to increase our efficiency and flexibility with the aim to maintain normal service capacity for the general public and to, at the same time, meet the increasing demand from COVID cases. Our service level is normal. For non-emergency service, it remains stable thanks to them. In the coming future, if we see an increasing number of cases, we don't rule out the possibility of any service adjustment. So I'd like to appeal to the general public. We need your help. Get vaccinated, whether it is vaccination for COVID or influenza. And as mentioned before, make use of these different avenues to seek medical attention, because if you get medical attention as soon as possible and take antiviral medication, you will be treated in the most effective way, and they have proved to be most effective as well. I'm from Singtao. I'd like to ask a number of questions. First, about the 5-year-old boy. Does he suffer from any chronic illness? One dose, is it a coronavac or BioNTech? In relation to critical cases of COVID patients, is it something to do with the change in weather? Would you pay more attention to utilization of pediatric wards? Are you concerned that there will be an over-utilization? Last week, you gave us information about reinfection. Can you give us number of reinfection cases? Has the percentage increased? We see that the number of imported cases has dropped slightly. Does it mean that its impact on our epidemic situation has alleviated? Is there any room for further adjustments in relation to imported cases? You've asked a number of questions about individual cases of children infection, about the situation in pediatric wards. About care homes, I will defer to Dr. Ao. Let me answer first. The utilization rate of pediatric beds is 62%. But as you understand that we have fewer pediatric beds than other beds, we are concerned that if we have an increasing number of cases, there will be pressure. But for children, the condition may change rapidly. So please, if you notice any change in the condition of your children, do not hesitate. Take them to see a doctor. Let me supplement the case of the 5-year-old boy. The boy was otherwise of good health, and on the 13th of November, he received 1 dose of Comirnaty. Reinfection cases in care homes. In the past 4 weeks, between the 5th and the 26th of November, for care homes for people with disabilities, about 19% of the COVID cases are reinfections. That means they have been confirmed before. That's mainly 90 days before they become reinfected again. In relation to care home for the elderly, about 32% of the COVID cases are reinfected cases. The percentage is higher, slightly higher than the percentage in the community. For cases in the community in the past 4 weeks, about 3.6% is reinfection cases. Overall speaking, the percentage of reinfection is climbing up. Over the past few days, it has exceeded 4%. We estimate that the trend will continue with the emergence of subvariants and previously confirmed people who are not fully vaccinated. If there is any subvariant, there is a higher risk that they will be reinfected. About imported cases, well, as you've heard from Dr. Ao, imported cases account for about 45% with slight changes. We reckon that as more people come back from overseas, even if the percentage stays at 4 or 5%, the absolute figure will increase. It looks like that the trend of imported cases is stable, but we need to see it against the background of local cases. In the local situation, there is an increasing number of cases, and the rate of increase is rather rapid. If we allow more people to come back from overseas, we need to consider two things. First, with more people coming back, then there is a high chance of new subvariants. Are we able to cope with that? Secondly, the old and the young. We heard today that there are some children cases. That's tragic. But why did the children get infected? It must be because of COVID virus in the community. If they have a lower immune system, then the virus will pose a bigger threat to them. Against this background, if we relax cases against imported, if we relax any measures against imported cases that we not appropriate.
Why is a recent surge in the death rate? And the second question is, how long will the government observe before considering whether to tighten social distancing measures? Thank you.
Okay. Recent surge of death rate.
We have noticed that a significant increase in the number of deaths. As you know, there will be a delay or in the number of deaths recorded, because whenever a person is infected with COVID, then after the condition, if the conditions deteriorate, then maybe 1 to 2 weeks later, then the case might pass away. So we have noticed that as the current wave started to increase since mid-November, and the number of cases gradually increased. So the increase in death cases recorded in the past 1 to 2 weeks reflects the situations, the increase starting in mid-November.
Maybe I supplement a bit more about the increased surge of death rate. According to data from the hospital authority, we observed that the patient, after having the COVID, come to the hospital or seek medical advice is a bit delayed. So that's why Dr. Lee from hospital authority just keep showing the slide, encouraging people, in case you have symptoms, you have tests, please, contact your medical practitioners or seek help as early as possible. We do not want to see, we were very unhappy to see if you know that you are positive, but you delay seeking help from the doctors and delay taking the drugs, which can actually cure you and shorten your period of sickness. So that's why we do this advice or drive. Hopefully, the patients can actually seek help as early as possible. This is probably one of the reasons why we can see a surge of death. People still actually do not like going to hospital, do not like to see doctors. This is quite a common phenomenon. And concerning consideration of further restriction for the antisocial or the social distancing, as we know, we meet you every week, and then we, review the social distancing measures every 2 weeks. And we still think that this pace is appropriate at this moment. Although we actually, change the measures or consider to change the measures every 2 weeks, but basically we observe the data and the trend every day so that we can make timely adjustment of all the measures. At the current moment, we still think that we are in quite a good observation and a good inspiration. It's actually a good observation about the trend of the infection. So we do think that the pace actually of restrict or tightening or relaxation of the social distancing measures are still appropriate. Hopefully we do not need to shorten it into 1 week or days. This is the last thing that we want to see. And it is exactly why we actually tailor-make the relaxation of the social distancing in a slower pace at the very first beginning, which receive a lot of feedback and people saying that we are too slow. It's basically, but during COVID or during any outbreak or any pandemic, this kind of small steps and a phased approach should be more appropriate, and it's actually increasing the adaptation of the society.
好，下一個提問，左手邊最後嗰行男士。
On the right, the male from TVB. The epidemic situation surpassed 10,000 cases since September. How does the government make of the current situation? Will it show a decrease afterwards, or will it continue to increase? The temperature plummeted and we have entered winter. Are you concerned about the onslaught of the sixth wave of the epidemic? If we have to tighten social distancing measures, does it mean that we have to take steps back? We have to backtrack? In terms of child serious cases, some scholars said that the children vaccine uptake is very low, which is not acceptable. Is there any way to boost the vaccine uptake in this age bracket? Will you consider decreasing the age restriction in relation to vaccine pass? That is right. The caseload today shot up to 10,000 cases. Can we actually forecast it, whether it will go up or down? We are yet to see any decreasing trend. Whether it will go up, no one can actually foresee. COVID-19 is capricious and is highly transmissible. Apart from the increase in the number of confirmed cases, we also have to take a look at the capability of the public healthcare system. That is to say, whether the hospitals can cope if someone seeks medical attention. Right now, it seems that hospitals can still cope, but then we have to tread cautiously. This is the stage we are in right now. In terms of serious cases, yes, we are seeing groups of the young and the old, so we have to work harder on this front, including, on the first hand, we have to get vaccinated. On the other hand, there is something citizens can actually do. First, personal hygiene, wear your masks. And I really see people on the streets not wearing masks properly. And it's high time you reminded yourself of the need to wear masks properly and wash hands regularly. Secondly, tests. I know that some industries require testing before going to work. And some people have the habit of doing tests before going to high-risk areas, and you have to make an assessment how high the risk you have. Citizens have to make good use of tests to early identify whether they have been infected and seek medical attention as soon as possible. Fourth, social distancing. If we did the first three things well, we have room to see whether we can further relax social distancing measures. That is why the fight against the epidemic requires concerted efforts. The government requires efforts of the citizens in order to fight the epidemic. Regarding whether we will backtrack, this discussion, it's actually quite special. However, no one indeed wants to backtrack. We have to understand the situation clearly. We do not want to not backtrack at the expense of the health of citizens. At this stage, we do not see the need to make adjustments. However, when the situation worsens, for example, in Canada, if coronavirus plus RSV plus seasonal influenza, the fact that we have to tighten social distancing measures is not solely due to COVID-19. There are other factors at play. We are not at that stage right now. Regarding child vaccination uptake, regarding children aged 6 months or above, they can already get vaccinated. It is actually, is it very meaningful for us to impose vaccine pass on a child aged 6 months old? However, if the vaccine pass requirements apply to parents, we believe that they definitely have concerns if they do not want to get vaccinated. For example, side effects or misunderstanding of the vaccines. We probably can allay the concerns of parents if we can give them a better picture of the vaccines. Dr. Siu brought to us some serious cases which reminded us that we have to remind children to wear masks and even get vaccinated. This is what we want to bring to you all. Next question, on the right in the last row. AM730. First of all, on children cases. For the 3 COVID cases, were they actually critical? Also boy cases? Are there any unannounced cases which have already become stable? Can you share any of these cases with us regarding seasonal influenza? Do the CHP and the HA have any statistics or A&E situation showing the start of the winter seasonal influenza? Should measures be tightened? You do not rule out the possibility. That is to say, when A&E department could not cope, there is any social distancing measure in relation to hospital?
Does the hospital authority have the figures relating to children? No, we don't. About a seasonal influenza, let's defer to Dr. Ao. The Center for Health Protection has used a different system to monitor the activity of influenza, and said the latest week, it is still below the baseline. So there are no signs showing that we have entered the seasonal influenza period. In our news about influenza on the website, you will get the latest information in relation to percentage of a positive case of influenza. It stays at 0.75%, which is low. But a lot of places in the Northern Hemisphere, especially in Europe, as some countries in Europe as well as in North America, they have entered the winter influenza season. We have visitors coming from these places, so there is a chance that the influenza virus may enter our community. We hope to make use of our existing measures to reduce relevant transmission risk. In the past 3 years, we have recorded very few cases of influenza because of personal hygiene regime and social distancing measures. We have effectively stopped the transmission of influenza. Because of the few cases, we are concerned that the immunity of the general public against influenza has dropped. Let me make an appeal. Because of the situation overseas, we may see a peak of influenza cases in Hong Kong. Please get vaccinated. And as to whether to relax or tighten our measures, I've actually answered the questions many times. Now, the COVID virus is very clever and is very fickle as well. So we need to be more flexible. We need to react more swiftly than the virus. We need to find out how much room we have to make adjustments. I'm sure that Hong Kong people are very clever when it comes to handling things in a flexible way. It is not wise to give an undertaking as to whether we will relax or otherwise measures. It is better to observe the situation first before we make a decision. In Canada, there are more cases of influenza. Influenza has arrived earlier in other places than in the past, but that is not the case in Hong Kong. But we need to stay vigilant just in case it arrives early in Hong Kong. We do need to observe the situation to see whether it is happening. we appeal to the public to get vaccinated against influenza and COVID because we need to be well protected and well prepared. We have exercised care and we have made many appeals. Influenza hasn't affected us in past years because we have been wearing our masks properly. But if children are not vaccinated, then if we're under the attack of the influenza, we will suffer greatly. So we do need to better protect our vulnerable groups. We've heard from Dr. Seal about the cases. For the 3 cases involving children, they have stayed in ICU, 2 boys, 1 girl. On the right, last but one row, the one in black. I'm from cable TV about elderly homes. Just now you said that a lot of the cases were found in elderly homes. Would you arrange for bivalent vaccination in elderly homes? Would you speed it up? When will it be available for residents in elderly homes? About anti-epidemic measures, yesterday in Taiwan, the order to wear a mask has been relaxed. But now we have an increasing number of cases. You said just now that you don't rule the possibility of backtracking. What's your view about the huge difference between these anti-epidemic measures between Hong Kong and other places? When will we be able to take off our masks? About bivalent vaccines, when it comes to a booster, whether it is the original vaccine or the bivalent vaccine, they are equally effective. The most important thing is get vaccinated as soon as possible. About bivalent vaccines in elderly homes, I think experts are still having a discussion and they have yet to arrive at a conclusion. It's not appropriate for me to comment on anti-epidemic measures in other places. We should focus on the situation in Hong Kong. We hear about a lot of children cases. Some of them are in a serious condition. We all know that washing our hands regularly, wear your mask properly, are effective ways against infection. And these measures are easily done. Why don't we do it? In the past few years, people have been wearing their masks, so we have very few influenza cases. It is proof that the wearing of masks will prevent upper respiratory infection and other infections. It is not wise to say now whether we should remove our masks. Dr. Lau as well as Dr. Professor Yun Kwok Yong have been emphasizing the importance of wearing masks. Well, if it's something easily done and that will protect yourself very effectively, why not do it? The reporter in gray. Just now, you mentioned that you won't make any comparisons between Hong Kong and other places, say, for example, Taiwan. Today, we have over 10,000 cases. You said that there won't be any relaxation. When will there be any relaxations? Can you give us some criteria so that we can gauge when we'll be able to take off our masks? What's your media outlet? Well, let me say this again. There are 4 effective ways to fight against the epidemic. First, wear mask, vaccination, tests, as well as social distancing measures. We have over 10,000 cases today, and we have an increasing trend. It is not appropriate to discuss whether we can remove our masks. Of the 4 measures I've mentioned, that is, masks, vaccination, tests, and social distancing measures, it will be social distancing measures that still has some room for adjustment, but we need to assess the overall protective barrier in the general public. if the vaccination rate is ideal amongst the old and the young, if there is a good coverage of vaccination, then we have more room. It's been 3 years since the start of the epidemic. We can't just decide on a few factors alone. We need to take into account a basket of factors. Say, for example, whether there is any subvariance. What about number of cases here in Hong Kong? Number of cases in nearby areas? Vaccination rate? Is a basket of factors and not just one or two factors alone. Last question, the one on the left. I'm from Hong Kong 01. I'd like to ask, today we have over 10,000 cases. 5-year-old is in a critical condition. The 5-year-old has received 1 dose. We talk about the age, those between 18 and 49. The vaccination rate among this group is quite good. Well, for young children, 1 dose, and the child is not in a critical condition. Do you have a new take on the effectiveness of vaccination and the COVID situation? Those in a critical condition are mostly those with chronic illnesses. Just now, the Undersecretary talked about the young, the old, and the chronically ill. They might be affected by the community. Apart from encouraging people to get vaccinated, are there any other ways to better protect the old, the young, and the chronically ill? I guess your first question was, well, vaccination rate between those the age of 18 and 95 and 59 is quite good, but we still have cases amongst children. Well, the problem is that for young children, the vaccination rate is not ideal. For those who are fully vaccinated and if they are young, even if there is a confirmed case, the condition may still be mild. You won't end up in ICU. But for the old and the young, and if they are infected, they may not react as well. The condition may become serious or critical, and they may end up in the ICU. But for those between the age of 18 and 59, the vaccination rate is good. But for the old and the young, the vaccination rate is not high enough. So the death toll is higher too. Regarding health advice for the young and the old, I have actually been repeating the appeal. You have to observe good personal hygiene, wash your hands regularly, do not rub your eyes, wear your masks properly. In high-risk situations, please make sure that you wear a mask and do tests regularly. If you feel unwell, please do a test. And if it shows that you are infected, go to see a doctor. There are 5 different ways for you to see a doctor. Please, we need to prevent infection. We need to make sure that there is early identification and early treatment.
個案。
One more question in relation to children cases. I'm from Ming Pao. Regarding the 3-year-old influenza case, any travel history of the family? Why was it taken to the children's hospital? Any earlier cases of winter influenza? Regarding the baby boy 22 months ago, when was he infected? What about his family? And it's not the time to tighten social distancing measures. So when will we decide to tighten social distancing measures? And when we have to take a longer time before we can tighten measures in relation to vaccine pass, how many people are actually eligible under vaccine pass? You have actually asked quite a number of questions, and I'm going to miss some probably. First of all, regarding the baby boy aged 3 years old. Because of influenza, he went to Queen Elizabeth Hospital yesterday. He was vaccinated with a flu vaccine, but then it takes 2 weeks for the antibodies to kick in because of a short period of time. There is no immunity built up yet, and that is exactly why we advise children to get vaccinated with both vaccine as soon as possible. The second question relates to the 22-month-old baby boy. Actually, he was not in the Hong Kong Children's Hospital. He went to a private hospital because of 3 days of fever. He had cardiac arrest and was transferred to the hospital. We still have to get a better understanding of the reasons. Regarding pressure on the public healthcare system, I would defer to Dr. Lee in relation to the stage. If the HA cannot accept any more new services, or it has to make substantial adjustments in order to provide services to COVID-19 patients, it's time we will have to tighten measures. That is why the HA has a plan. We have already mobilized some 2,000 hospital beds, and from North Lake Hospital, the Hong Kong Infection Control Center, 10 wards. For Asia World, it is on standby mode. Right now, take hospitals and AWE as examples. There is some little room for us to redeploy resources to care for an increase in the number of COVID-19 cases. However, as I mentioned, we are actually in face of two difficulties. First of all, we have to remain normal service capacity. Secondly, non-COVID-19 cases also surged because of the changes in temperature. We are relying on our dedicated medical officers in the front line to stay vigilant. That is to say, when it comes to treatment, whether COVID-19 or not, they deploy the resources promptly in order that patients can be admitted to the hospitals and can receive treatment as quickly as possible. And actually, we are doing our level best at the right time. If there is a surge in the number of cases in the future, we are actually concerned that we might have to adjust our services. Some reporters asked what citizens can actually do. We understand that vaccination is going on quite well, but it is important, as the slide mentions, some citizens delay in seeking medical attention, whether it be report or seeking medical attention. So we hope that citizens can seek medical attention or make reports as quickly as possible, get medications as early as possible. As long as you do not have to go to the hospital, you can help reduce the pressure of the hospital. Thank you for attending the press briefing today.